Hello and welcome to Diplomatic Passport on ZTN, a program where we give you a daily outlook on the COVID-19 situation in Zimbabwe and the region as well as across the globe. And this show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Manatsi, and we start by taking a look at COVID-19 statistics released by the Ministry of Health. As of yesterday, 266 new cases of COVID-19 were reported from 6,482 COVID-19 tests conducted. This, of course, representing a positivity rate of 4.1%, taking the number of active cases as well to 2,745. A single death was recorded, bringing the cumulative fatalities to 4,551, and the cumulative number of COVID cases now stands at 127,083. Of these, 119,787 being recoveries. That's slightly over 94%. Zimbabwe currently has 107 hospitalized cases of COVID-19, 6 being new admissions, 4 are symptomatic, 80 are mild to moderate cases, while 23 of these that have been admitted have severe symptoms, while there are currently no COVID-19 patients in the intensive care unit. Let's go on to Zimbabwe's vaccination program. 18,244 people received their first dose yesterday, bringing the cumulative for the first dose to 2,892,137, while 36,811 received their second dose, and this brings the cumulative for the people that received the first and second dose to 1,963,058. So we're nearing the 2 million mark of fully vaccinated people for Zimbabwe's population. Zimbabwe is also working towards achieving a 60% herd immunity target. This is for the year end by end of December, and most African states are projected to miss their herd immunity targets. That's according to the Africa CDC. And on the African continent, total cases right now stand at 8,096,504. The 204,821 deaths are recorded. That's across the African continent. Let's find out how much Africa has done in terms of its vaccination is concerned. And we have Dr. John Nkengasong, who is the director of the Africa Centers for Disease and Control and Prevention. That's Africa CDC.
WHO and ourselves are still pushing for at least the continent to acquire vaccines enough to immunize up to about 30 to 40% of its population by the end of the year. I think that is an ambitious target, but it's a target that if we are truly determined that we need to get this pandemic out of our continent, that is a reasonable target to try to achieve. We also discussed, as I said, manufacturing, that we will need to accelerate the process and then work with the spirit of an ecosystem. That way, it's not one country manufacturing vaccines and then nobody else does that, but then we work collectively so that the vaccine process, the manufacturing process is actually spread out, is regionalized, and then it is the whole of Africa approach in manufacturing vaccines. So in the coming days, we will be inviting entrepreneurs and working with the Afro-Exim Bank to really sit down and go through the detailed process of what does it really take, and inviting them to be part of this process. As you recall, about 10 countries in Africa are now aggressively pursuing vaccine manufacturing. And I think this effort will actually help us move, not just focus on the fill and finish, but look at the entire ecosystem of how vaccine manufacturing should be pursued on the continent.
And uptake of the COVID-19 vaccine in Africa, particularly in the middle-age demographic segment. This, however, has not been met with a corresponding supply pattern of the vaccine, as some African nations have already struggled to keep that steady supply of vaccines to ensure that their programs of vaccinations happen smoothly. But recent reports also indicate that Africa has contributed just over 2% of global vaccine consumption vaccination figures. And Strive Masiyiwa, who is the African Union Special Envoy and head of the African COVID-19 Vaccine Acquisition Task Team, that's AVAT, say that Africa was not depending on donors for its vaccination programs, and calling rather on manufacturers to instead up their supply lines to Africa, as the continent is ready to actually procure the same vaccines from them. The African Union envoy also emphasized the need for Africa to manufacture its own vaccines and make an appeal also for the release of vaccine intellectual property. Let's hear what he has to say.
So, Director General, if I may, with respect to this question, just quickly clarify one issue. As AVAT and the African Union, we want to buy vaccines. We're not asking for donations. You can donate to us if you so wish, but our basis is not a donation. That means we want access to purchase. We call on those countries that have put restrictions on exports of vaccines as finished products, exports of ingredients, drug substance. These restrictions are even more urgent for us today than intellectual property, because the intellectual property doesn't deliver a vaccine to us tomorrow. But an export ban lifted in the United States, in Japan, in China, in Korea, South Korea, India, that will give us vaccines immediately. So we urge you to put that into the mix. We always appreciate a donation, but a donation is at the discretion of the donor. We want to buy. At the same time, we as Africa will now address this through setting up our own manufacturing capabilities. We therefore support, particularly the calls, particularly for that intellectual property which was put in place as a public good by American taxpayers, European taxpayers. They financed some of this intellectual property, and it should be for the common good. So it's not wrong that we should say there should be waivers. It was for the common good. So we ask for this IP to be made available, and we will continue to stand behind that. It's not an unreasonable call.
So the issue of unequal drug distribution and access remains a topical issue for debate, and the World Health Organization, that's the WHO, in its access framework identifies 4 main pillars when it comes to access of medicines and essential drugs in developing countries, particularly looking at rational selection, issues around affordable pricing, and also sustainable and adequate financing in order to deliver the drugs to the developing nations. In light of also stringent intellectual property rights, could differential pricing be an option maybe for the solutions in terms of improving vaccine access, especially to the middle income developing countries and well-to-do populations in poor countries? Furthermore, we would also want to explore would relaxing of COVID-19 vaccine intellectual property rights improve the global access and also equity of drugs? Well, a global advocacy campaign is currently seeking to exempt COVID-19 vaccines from its intellectual property protections, and contending that this action will actually mobilize additional manufacturers and also help address vaccine access disparities. Others are arguing that doing so could also dissuade additional manufacturing investment and also undermine long-run vaccine developments, including addressing the emerging COVID-19 variants, because if we do look at it, many billions of dollars do go into research and development of drugs at the end of the day. But now it has been over half a year since the launch of the COVID-19 global pandemic vaccination program, which started in February, and with a handful of new vaccines already approved for emergency authorization and millions of people recently inoculated. It is becoming increasingly likely that the world may also soon quite even be in one distinct way. Hundreds of millions of people in wealthy nations will be vaccinated, while others in poorer parts of Africa may not have access to that. But other vaccine manufacturers are taking a different leaf. Moderna, a pioneer in the development of messenger RNA, that's mRNA vaccines and therapeutics, has led the way in its initiative of making vaccine intellectual property available. And in a statement they released, the company said beyond Moderna's vaccine, there are other COVID-19 vaccines in development that may use Moderna patented technology, and we feel a special obligation under the current circumstances to use our resources to bring this pandemic to an end as quickly as possible. Accordingly, while the pandemic continues, Moderna will not enforce our COVID-19 related patents against those making vaccines intended to combat the pandemic, and further to eliminate any perceived intellectual property barriers to vaccine development during the pandemic period. So Moderna opening up their intellectual property rights and taking off the requirements that are needed and some of their patents to make sure that their technologies are accessible to world-beam manufacturers, just like Strive Masiyiwa had indicated there. Well, this brings us to the end of Diplomatic Passport for today, a show that's brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Munatsi. We are back again tomorrow, same time. Do make a date with us. It's bye-bye for now.